Former Vice President Dick Cheney undergoing a heart transplant. He is still recovering this morning, but some are raising questions about whether the vice president is too old for a new heart. ABC's David Curley has a story from Washington. Good morning to you, David.
Good morning, Bianna. Cheney had hinted that he was thinking about getting a transplant, but this news was really a bolt just hours ago. It came in a statement from his family. In a hospital just 8 miles from his house, former Vice President Dick Cheney has a new heart beating in his chest. Cheney had spent 20 long months on a waiting list. His family said in a statement they, quote, do not know the identity of the donor. They will be forever grateful for his life-saving gift. The 71-year-old has a long history with heart disease, including 5 heart attacks, the first at age 37, the latest just 2 years ago. Cheney told ABC's John Carl about the pump he had installed in 2010.
It's originally designed as a transition to transplant. The heart transplant is still a possibility.
The battery pack and pump was keeping Cheney's blood flowing until he could get a transplant.
A little over a year ago, I was at end-stage heart failure. My heart wasn't pumping enough blood to service my kidneys, my liver, and so forth.
Cheney has been a controversial figure, and this surgery is no different. Dr. Eric Topol, who consulted with Cheney in his first run for VP, asked publicly whether Cheney was too old to be given a new heart, saying, quote, it would be interesting to find out how this all came about. Was the match suitable for other individuals? Will he ever find out, or will this be kept under wraps? It's not that he shouldn't get a transplant. It's a question of who didn't get one. But Cheney's wait for a heart is actually considered slightly longer than usual. Most wait 6 months to a year. And it's not unique that somebody of Cheney's age gets a heart transplant, but on average, recipients are usually a bit younger. Bianna?
All right, David, and we want to bring in ABC News Senior Health and Medical Editor, Dr. Richard Besser. Great to see you, Dr. Besser. So I want to go back to what Dr. Topol said. He is just one doctor, but he raised a question a lot of people are asking. Is 71 too old for a heart transplant, and should it have gone to a younger candidate?
You know, there used to be a hard age cutoff at 55, and some hospitals are still using 65. But I talked to 2 leading transplant surgeons last night, and they no longer use age. If the rest of a patient's body's fine, no kidney disease, no previous strokes, age is not a factor at all.
And we know that he had been wearing that ventricular assist pump for 2 years now, so he had been readying himself for a heart transplant. Right. He had told our John Carl. Another question people ask anytime someone prominent receives a transplant, from Steve Jobs to now former Vice President Dick Cheney, was there any preferential treatment? Did they jump the line? From what you see now,
right. I mean, we don't have all the details, but from what we see so far, it doesn't look that way. I talked to the head of transplant at UCLA, and there the wait is 3 to 6 months. Here it was 20 months. We don't know why, though. Some patients who have this assist device do so well that they're in no rush to get a transplant. We don't know if it was from that or if it's had something to do with the vice president's blood type, where it took a little longer.
And quickly, prognosis for recovery?
Well, you know, he's had 2 prior surgeries, so this immediate period is the most critical. But 1 year survival for someone his age is 83%. 5 years is 63%.
So the odds are in his favor.
Very good survival
All
rates.
right, Dr. B, we appreciate you coming in. We wish former Vice President Dick Cheney all the best this morning.